Erectile dysfunction frequently appears as the initial sign of another underlying issue, such as heart disease. It is crucial to consult a healthcare professional if you have experienced difficulties achieving and sustaining an erection. In this video, we are going to discuss what is erectile dysfunction, handling and medical interventions, diagnosis and examinations. Penile disorders include erectile dysfunction. It interferes with your ability to achieve and sustain an erection strong enough for engaging in sexual activity. The ability to achieve and sustain an erection is greatly influenced by your emotions. It is vital to feel at ease, self-assured, and stimulated. On the other hand, occasional erection problems are common. Problems with erection may arise if you experience nervousness, anxiety, frustration, or fatigue. Alcohol consumption and drug use can also have an impact. It may also be a side effect of specific drugs or cancer therapies, or it may be the outcome of other illnesses. Making an appointment with a healthcare professional is a smart option if you are experiencing problems achieving or sustaining an erection. ED frequently appears as the initial sign of another underlying issue, such as a heart disease. It is crucial to consult a healthcare professional. Impotence is another term for erectile dysfunction. Incapacity. Also, which erectile dysfunction variety exist? Healthcare professionals classify ED patients into multiple groups. Dysfunction of the vasculature. Affected blood veins that supply blood to the tissues in your penis that enable you to achieve and sustain an erection, as well as the penis's natural blood-holding valves, are among the causes of vascular ED. ED, that is vascular, is the most prevalent kind. Erectile dysfunction caused by neurons. Nerve tissue that obstruct the transmission of information from your brain to your penis to produce an erection are the cause of neurogenic ED. Trauma, pelvic surgery, radiation therapy, or neurological diseases such as multiple sclerosis, spinal stenosis, and stroke can all cause this. Erectile dysfunction caused by hormones. The term hormonal ED describes ED caused by a lack of testosterone, or in certain situations by thyroid problems. Erectile dysfunction caused by psychosis. Conditions that impact your ideas, feelings, or behavior are known as psychogenic ED, and they can lead to ED. What age range is typical for erectile dysfunction? According to medical experts and providers, more than 50% of men between the ages of 40 and 70 who identify as male experience ED. And the numbers might be greater because a lot of people put off getting treatment. What is erectile dysfunction's main cause? The most prevalent cause of ED is conditions that interfere with your body's capacity to supply blood to your penis. If you are 40 years of age or older, you may be at an increased risk of developing ED, being diagnosed with diabetes, possess a BMI more than 25, experience depression, have no physical activity, or a cigarette smoker. How is a diagnosis done for ED? A medical professional can identify the cause of ED and make a diagnosis. They will examine you physically and go over your medical history. Inquiries concerning your past sexual and personal interactions will be made. These inquiries could cause you to feel awkward or embarrassed. However, in order to identify the cause as soon as possible, it is important to be truthful with the provider. The inquiries could concern: do you currently take any medications, including over-the-counter, prescription, herbal, nutritional, and non-medical pharmaceuticals? Have you ever received a diagnosis of anxiety or depression from a medical professional? Do you get anxiety frequently? Do you have any issues in your relationships? How frequently can you achieve an erection? How powerful are your climaxes? For what length of time can you sustain an erection? Do you ejaculate earlier than you would like to? Which causes you to lose your erection? When did you initially become aware of ED symptoms? How did you initially experience the symptoms of ED? Do you or have you ever had erections in the morning or at night? Which sexual postures do you frequently adopt? Also, the provider can ask to speak with your partner. Your spouse could have more knowledge about such causes. To validate their diagnosis and identify the root cause of ED, the clinician could prescribe testing, handling, and medical interventions, cardiopulmonary training 3 times a week, or at least 45 minutes of intense aerobic exercise, could help reverse some mild cases of ED. Exercises for the heart can include swimming, cycling, jumping rope, jogging, and brisk walking. Giving up smoking after several months stopping smoking can improve things. Speak with a sexual therapist. Low-intensity focused shockwave therapy for penile patients. Through the use of sound waves, this non-invasive treatment increases blood flow. It can take 2 months to observe results. Medications that you inject straight into your penis to induce an erection. Mix of many drugs. Medication administered by injection begins to act in 10 minutes. Penis pump, a vacuum constructing device. Penis pumps function nearly instantly. Testosterone replacement therapy, offered in pellet, gel, injectable, and patch form. Within 4 weeks, testosterone replacement therapy begins to show results. If you think you need treatment for erectile dysfunction, please consult your healthcare provider as soon as possible. Also, if you found this video informative, please do not forget to hit the like and subscribe button. Also, share it with your loved ones. Till next time, stay happy, stay healthy. Bye-bye.